Dr. James Weinberger. I'm the director for the Center for Male Fertility at Reproductive Partners Medical Group and Fertility Centers of Orange County. I'm happy to talk to you today about hormones in both men and women. So estradiol has a lot of functions in men, even though it's sort of typically associated as the female hormone. Estradiol is really important for bone health, for libido, for lipid health, and even for fertility. So if estradiol is too low in guys, it can really diminish a guy's libido or sex drive. And it also really is important for healthy bone mineral density. So estradiol is a better measure of bone health than testosterone in guys. In contrast, if estradiol is too high, then it can lead to issues again with libido. It can sort of sap libido, but in addition, it also can cause what's called gynecomastia, or increased breast tissue accumulation. It can cause breast tenderness, and then finally, estradiol is a really important part of what we call the HPG axis, which is basically the brain's talking to the genital organs for both men and women. So in guys, if estradiol is too high, it can be a signal to the brain that the pituitary doesn't have to send more signal to the testes to do their job. And the testes have to do two jobs. That's make sperm and make testosterone. So if estradiol is too high, it can actually disrupt or slow down those processes in guys. So we talk about this inverted U curve for men with estradiol. And what that means is that we want estradiol usually to be between about 20 and 40, but we'll tolerate between 15 and 50 as well. And the inverted U is speaking to the fact that if estradiol is too low, that you get all those negative effects on bone health, on lipids, on libido. And if estradiol is too high, it can disrupt, again, libido and sex drive and fertility. So we want to keep it in that healthy U. And in terms of important ratios between, let's say, testosterone and estradiol, the literature really supports that you want a ratio of at least 10-1 between your testosterone and your estradiol. So if those numbers are closer in range, then you don't have optimal hormonal milieu or environment for sperm production. So that's what we shoot towards. So it's really typical for people to associate testosterone as the male hormone. But what many don't realize is that women actually have more testosterone than they do estrogens. They have about 5 times more testosterone than they do estrogens in their body. And that's because testosterone is the precursor to all forms of estrogen in both men and women. So testosterone gets turned into or aromatized into estrogens. And so that testosterone is really important for many things in women, the same way that we sort of really value its importance in men. It's important for general health, it's important for lipid profile, and it's important for sexual health. So in women, we need testosterone for desire, in other words, for libido sexually, but it's also important for maintenance of bone health and for a healthy lipid profile, so triglycerides and cholesterol. So it's a great question. There are a number of barriers to TRT in women, and probably the number one is that we don't have an FDA or regulatory approved testosterone product in women. And so when doctors have to prescribe testosterone to women, they're doing it off-label, which means that they're first of all doing something that's not technically sanctioned, not illegal at all or anything like that, but just not typical, meaning that they have to change the formulation or use a compounding pharmacy to have the appropriate prescription for women. And so that's just an extra step that a lot of providers either aren't comfortable with or aren't familiar with. The other big barrier is a historical one, something called the Women's Health Initiative. And this was a big study in the early 2000s that came out with findings that suggested that hormone replacement therapy for women was actually potentially dangerous, and it associated hormone replacement therapy with an increased risk of breast cancer. Now, there have been a number of studies since that have shown that that association is not causative, and in fact, they looked at that population of patients that were in the Women's Health Initiative and have since followed them and shown that that's not the case. But when that came out, it came out to a lot of fanfare and a lot of publicity, and it put this association in the mind of patients and providers. And so that's sort of the uphill battle, and that's probably one of the fundamental reasons why the products that have been proposed to go through FDA, which showed good efficacy for the things in women that testosterone is useful for, were not approved. In fact, it was cited at that time that there were still fears about consequences of hormone replacement due to the Women's Health Initiative. And so I think it really sort of goes back to that. So there are guideline statements for providers to follow. In those guideline statements say that the best practice is to use testosterone products that are FDA approved for men at about 1/10 of the dose. So you can do that with injections. It would be about 5 milligram injection of testosterone cypionate or testosterone enanthate weekly. You can do it as gels or creams. Now, best practice really is to use a testosterone cream, and rather than using a whole tube of the cream daily, which is the amount for men, you use a pea-sized amount, or about 1/10 of it, applied to the back of the calf daily. Now, the way that you manage it is you titrate it to what's called a calculated free testosterone. In other words, a free testosterone value between 0.4 and 0.7. And then if a patient has what we call androgenic side effects, in other words, testosterone-driven side effects, let's say they start to get acne, or a female patient starts to have some hair growth they don't like, or mood changes, well then rather than using that one tube over a period of 2 weeks, you tell the patient to use that tube over a period of 3 weeks or 4 weeks. And so you titrate to symptoms and side effects, and you titrate to lab values. And those are the best practices for the situation we have now. Yeah, I think it's just important that that patients see providers who understand that it's the whole hormone profile that should be evaluated. And the answer for men isn't necessarily just more testosterone. It's about having the right ratios and looking at all the hormones. And that for women, testosterone is a vital hormone as well. And we shouldn't be afraid to prescribe it.